So coming to cryopreservation and vitrification, the cornea is storage in liquid nitrogen at minus 196. The corneas are in a dormant state because the metabolism of cells are inhibited, and there is lack of accumulation of toxic metabolic byproducts, so it inhibits inhibition of microorganism. So the danger in cryopreservation is because intracellular ice crystals are formed. So there are techniques to prevent ice crystal formation. There are cryoprotectant which can cause, however, there is at the same time it can cause toxicity if it is used in high concentration. In vitrification, we go from solid to liquid transition without formation of crystallize, which is called glass transition temperature. And normally vitrified organs are brittle and damaged by thermal stress if not heated uniformly. So thawing must be temperature controlled to prevent endothelial damage. So coming to advantage, you can keep it for indefinite storage. Our viability of cells are maintained, but however disadvantages require expensive equipment and expertise. So loss of tissue function due to thermal stress caused during tissue rewarming. Glycerol preservation, I think it is one of the simplest technique. It is not a new, it was started long back, and there are a lot of modification to this process when it started, and it does not preserve endothelium. Mostly these are used for tectonic or DALK procedure. Dehydrating agent used in glycerol has antimicrobial and antiprotease activity. It can be preserved in normal temperature. Initially it was thought that it has to be preserved in minus 80, but now with the glycerol you can preserve in normal temperature. So the advantage, again, it is inexpensive and minimum use of technology, easy to adopt by iBank in developing nations. Currently also we keep some in case future emergency. It can be stored at room temperature and reduce risk of rejection if you are using for DALK. And disadvantage, you cannot use for endothelium, where you can use for optical purpose. Another way of long preservation is lyophilize. In this, the tissue is frozen, then it comes to vapor pressure lowered, and ice is removed because ice is toxic for the cells. Removed from frozen tissue by sublimation or change from phase of solid to vapor without passing through the liquid phase. The advantage of lyophilized cornea is again kept for extended period of time. This may be used as patch graft, reduce risk of rejection due to lack of viable cell, and disadvantage again is technologically expensive. Lack of viable tissue lead to corneal opacity, so it's again only used for tectonic or therapeutic purpose. Gamma irradiation, I think it is used by your iBank in Bombay. Dr. Muscati has experience in this. So in this frozen corneal tissue submerged in storage medium containing human serum albumin, and it is sterilized and validated by gamma irradiation process. There is a substantial change in physical and biological characteristic of collagen. Advantages can be stored up to 2 years, and again this can be used for patch graft or glaucoma salt procedure. And disadvantages required patented technology for processing tissue, lack of viable cells, corneal opacity after transplantation. This is the only long-term preservation. Again, this is not new. This is used in European iBank. It can be kept for 1 month, and it is a technically long procedure at this point of time in India because we have a waiting list and tissue is used. Compared to the cost and benefit, it is not a viable option. And tissue are not is a preservative media, but recent advances for the tissue is human tissue engineered cornea or synthetic corneal culture. So summary is we need some form of long-term preservation, but endothelium viability is the challenge. And surplus cornea, at least we use in our country is 50% is used and 50% is rejected, and most of them are for poor quality. This can be kept for emergency using all those long term. I think at this point glycerol is easiest, but in future maybe we can need to change to organ transfer or other media. And at this point of time, we do not allow to give it to outside India because for the waiting list, but in future when we need to transfer, we can be used for all those media which can, even if the endothelium is not viable for therapeutic or tectonic purpose. Thank you. And I'll take this opportunity to invite for the 14th National Conference of Cornea and Eye Banking in Bhubaneswar. And please remember the date is 14th and 15th of September.
Thank you, Sujata, for well ahead of time you have finished your talk. And any question to Dr. Sujata?
What is the prospect of this honey-based preservative for cornea? Have you tried honey-based preservative?
Honey-based preservative.
I'm not aware
Prospect.
of.
Have you tried? I think it will be a good medium, probably.
I'll just,
Seems
I've not tried it, none of us have tried it, but I've heard about it. The honey is like glycerol in the sense that it is an antiseptic agent, so the chances of infection are reduced. It's a thick mass. It works almost exactly like glycerol. You can keep it in room temperature, you can store it up to 2 years. Honey doesn't get spoiled over time. So it can be used, but glycerol is equally freely available and equally cheap. So most eye banks in our country, if they have to preserve, they preserve it in glycerol. There are isolated anecdotal reports of honey being used as a preservative.
honey can be sterilized.
Yes, but glycerol is equally easily available and cheap and does the same thing. And it's been, has a proven track record. So there is really no impetus for an eye bank to shift to honey. But I agree with what you're saying, that it works well.
The thing is that we follow the others. We don't want to start from ourselves.
True, true, that is true.
So I have a question to Kuresh that she has said about the gamma preservation.
Yeah, I'll just give you an update on this.
How you are doing it.
I'll explain. So in this closed room, I'll just tell you that there was, the technology was patented with this cornea gen, and another company, which was that? Eyesight or some?
Eyesight International.
So then the two companies merged and then separated, and in that this happened during the COVID time, and for the last 2 years we've been in correspondence with them, and because of their internal problems that they have not been able to share the technology with us. So we have gone bypass them, and Mr. Mahmood Farazdagi, who all of us know, who retired from there, that he's got the technology, and the technology which he's got is not patented. He's willing to share it free of cost with us. So everything has been cleared now. We are signing an MOU with him. It's a private MOU, and we have to start again from scratch because we had taken the permissions for that patented technology. So it will take about 6 months more before we start making gamma irradiated corneas. So we had made a few. Dr. Rajesh Fogla used them, but those were with those people's technology, so we can't use that. So with a small change in technology, we can go out of that patent thing, and we'll start doing it in about 6 months' time.
So how it will be different from glycerol preserved? Only the duration?
No, it is gamma irradiated, so it is completely acellular. It is unlike glycerol. There's no liquid over there. So our aim is to send it to all the eye banks and all the teaching hospitals in the country, send two of each, so that anytime they have a therapeutic. And they've seen anecdotal reports of these remaining clear for up to 2 years in spite of being acellular. Anecdotal published literature is there before it becomes opaque. So it takes some time to become opaque, unlike the glycerol preserved ones. So it has an edge over the glycerol.
But people are using it for DALC surgery mostly, and also emergency therapeutic PK. That, but it is sometimes difficult to handle
Sticky,
and
it's
suture.
difficult to.
That way, this has an edge over, and it is just like a cornea, but dried form. It
Correct.
is available in dried form. It is not a wet, so you have to soak it and you have to stitch it, and it is just like a.
Yeah.
So it is just like a normal cornea, but
This one will be like normal.
acellular. no cells are there.
Okay.
Yeah, Raki?